There are numerous causes of sleep deprivation, including jobs, chores, babies, anxiety, late-night television, and parties. Regardless of the cause, studies have proven that sleep deprivation negatively affects our mental and physical health. Our bodies secrete hormones that alter our mood, energy, memory, and focus when we sleep. On a driving simulator or a hand-eye coordination task, sleep-deprived individuals may perform as poorly as intoxicated individuals, according to testing. In addition, the current study has demonstrated that prolonged sleep deprivation can induce high blood pressure and lead to diabetes complications. If you suffer from insomnia, you can take numerous actions to modify your behavior and lifestyle in order to fall asleep. Here are a few suggestions for combating insomnia. 1. Wake up at the same clock every day. It is tempting to sleep in on the weekends, particularly if you have had a restless week. However, if you suffer from insomnia, you should educate your body to wake at a constant time by waking up at the same time every day. 2. Alcohol and stimulants such as nicotine and caffeine should be eliminated. Caffeine's effects can linger for several hours, possibly up to 24 hours, therefore the likelihood of it impacting sleep is high. Caffeine may cause not only problems falling asleep but also frequent awakenings. Alcohol may have a sedative effect for a few hours after drinking, but it might lead to numerous awakenings and an unrestful night's sleep. Ask your doctor when you should take stimulant medications, such as decongestants or asthma inhalers, in order to limit their impact on your sleep. 3. Limit naps. While napping may appear to be an appropriate strategy to make up for lost sleep, this is not always the case. It is essential to create and maintain a regular sleep pattern and to train oneself to associate sleep with cues such as darkness and a regular bedtime. Napping can impair evening sleep quality. 4. Exercise regularly. Regular exercise can enhance the quality and length of sleep. However, exercising right before bedtime might stimulate the body and should be avoided. Try to complete your workout at least 3 hours before you intend to retire for the evening. 5. Limit your bedtime activities. The bed serves just for sleeping and sexual activity. If you suffer from insomnia, avoid activities such as balancing the checkbook, studying, or making phone calls in bed or the bedroom, and avoid watching television or listening to the radio. All of these activities might boost awareness and make falling asleep difficult. 6. Do not consume food or liquids just before bedtime. Eating a late meal or eating before bedtime can stimulate digestion and keep you awake. If you have gastroesophageal reflux disease, GERD, or heartburn, it is even more crucial to avoid eating and drinking immediately before bed, as this can exacerbate your symptoms. In addition, drinking a lot of fluids before bed might cause the bladder to be overloaded, necessitating frequent bathroom trips that disrupt sleep. 7. Create a conducive sleeping environment. Temperature, illumination, and noise levels should be regulated to make the bedroom favorable to falling asleep and remaining asleep. Your bed should be comfy, and if you have a pet that sleeps in the same room as you and tends to create noise at night, you might consider having the creature sleep elsewhere. 8. Get your worries out of the way before you go to bed. If you find yourself lying in bed contemplating the next day, consider setting aside time to reflect on the day and create goals for the next day. The objective is to refrain from doing these things while attempting to fall asleep. Before leaving work, it is also beneficial to establish a list of work-related chores for the next day. This eliminates at least one set of worries. 9. Reduce stress. Before going to bed, there are a variety of relaxation therapies and stress reduction techniques that you may like to try. Biofeedback, progressive muscle relaxation, deep breathing methods, visualization, and meditation are all examples of alternative therapies. 10. Think about engaging in cognitive therapy. Some individuals with insomnia are aided by cognitive therapy in identifying and correcting improper ideas and beliefs that may contribute to their sleeplessness. In addition, Cognitive treatment can provide accurate information regarding sleep norms and age-related sleep patterns.